Hi my egos, my name is Cedie and thank you so much for watching this video. And for today, we're going to have another lecture discussion on some theories of personality, giving you only the basic tenets, the core concept, and the important information you need to learn. I hope if this is your first time to visit my channel, please do subscribe at my channel and hit that bell button for you to get notified whenever I post a new video. We're going to have another discussion, one of the mental disorders. Okay, we have schizophrenia. Okay, let's learn more about this mental disorder. How does it affects us? So schizophrenia is a psychotic disorder that disrupts the thoughts, okay, emotion, our behaviors, okay, disordered thinking, faulty perception and attention, disturbances in movement or behavior, and disrupted interpersonal relationships. So it means fragmented mind, okay? Schizophrenia is one of the most complex, chronic, and challenging of all the psychiatric disorders that affects how a person thinks, feels, and behaves. It represents a heterogeneous syndrome of disorganized thoughts, delusions, hallucinations, and impaired psychosocial functioning. So basically, okay, factors that have been associated with developing schizophrenia includes genetics, so namamana po siya, early environment, neurobiology, and psychological and social processes. That exact cause of the disease is still unknown. Alright, there's just still these factors, but the cause of this is hindi pa po natin alam talaga. So, viral infections and immune disorders, schizophrenia may be triggered by environmental events such as viral infections or immune disorders. For instance, babies whose mothers get the flu while they are pregnant, okay, they can develop schizophrenia later in life, okay? So, scientists recognize that the disorder tends to run in families, no? So, namamana siya, similar to some other genetically related illnesses. The risk of developing schizophrenia is increasing to approximately 10% if the first degree relative has the illness. Okay, so namamana talaga daw siya. The prevalence of schizophrenia ranges from 0 to 0.6% to 1.9%. Okay, this commonly has in its onset in late adolescence or early adulthood and rarely occurs before adolescence or after the age of 40. So ito po yung peak ages ng schizophrenia, 20 to 38 years old for males, 26 to 32 years old for females. Okay, so slightly more men are diagnosed with schizophrenia than women. Okay, and women tend to be diagnosed later in life than men. Okay, so we have different types. Paranoid schizophrenia, common form of schizophrenia, okay, prominent hallucinations and delusions may develop at a later age than other types of schizophrenia. Okay, so ito po yun. We also have Hebephrenic or disorganized schizophrenia. Ito naman po, yung behavior is disorganized and without the purpose. Thoughts are disorganized, difficult to understand by others. So, may mga delusions and hallucinations na fleeting, usually develops between 15 to 25 years old. We have catatonic schizophrenia. This is rarer. Rare po siya. Okay? Risk po yung mga malnourished dito. Okay? They are unable to talk. They have unusual movements and so on. Undifferentiated schizophrenia naman, they have the characteristics of paranoid, okay? Or hebephrenic or catatonic schizophrenia. Residual schizophrenia naman, past history of psychosis but only having the negative symptoms. So, meron po tayong positive symptoms, negative symptoms, and cognitive deficits. So, yung positive symptoms natin, yung presence po siya ng inappropriate symptoms. Yung dapat wala, pero meron. So, positive refers to overt symptoms that should not be present. This includes hallucinations, delusions, and disorganized thoughts. Negative symptoms naman, yung kailangan nandun siya, pero wala. Okay? So, ito po yung, okay? So, this refers to the lack of the characteristics that should be present. Kagaya po ng reduced speech even when encouraged to interact. Alodia. Lack of emotional and facial expression, no? Affective flattening. diminished ability to begin and sustain activities. This is avolition. Decreased ability to find pleasure in everyday, anhedonia, and the social withdrawal, asociality. So, dapat po, meron sila pero wala. Okay, ito po yung negative symptoms. Cognitive deficits naman is difficulty with the following aspect of cognition that can make it hard to live in a normal life or earn a living, kagaya po ng memory and attention. Okay, so please remember the terms. So yun, signs and symptoms. We have positive symptoms. We can define delusion. Okay, so delusion po, belief or contrary to reality and firmly held in spite of this confirming evidence. So delusions, for example, meron tayong thought insertion. So a person may believe that thoughts that are not his or her own but has been placed in his or her own mind, okay, as an external source. So for example, pinipilit mong may mga thoughts na talagang nasa mind mo na hindi talaga mawala, na hindi mo alam kung saan nanggaling. Pwede rin po yung thought broadcasting. A person may believe that his or her thoughts are broadcast or transmitted so that others know what he or she is thinking. So feeling mo, alam ng tao kung ano yung iniisip mo. Meron din tayong grandiose delusions. Ito po yung exaggerated sense of his or her importance. So feeling mo na ikaw talaga yung pinaka-importante sa lahat ng mga tao na nasa mall. Ideas of reference naman, yung incorporating unimportant events within a delusional framework. Okay? So, yun po. So, hallucinations involving seeing or hearing things that don't exist. So, this is in our senses, no? So, meron tayong nakikita, naririnig, or something in our senses. So, most common form of hallucination is hearing. Okay? Hearing po. Disorganized speech and thinking, effective communication can be impaired, and answers to questions may be partially or completely related. So, ayun po, disorganized speech. Hindi naga-match yung mga words or yung mga thoughts mo. Okay, refers to problems in organizing your ideas and in speaking so that the listener can understand. Pwede pong meron kang loose association or possible derailment. Ito po yung the case the person may be more successful in communicating with the listener but has difficulty sticking in one topic. Or tangentiality po, ito po yung going off a tangent instead of answering a specific question. Catatonia naman po, purposeless, abnormal motor activity or aggressive behavior. So, aside from the positive symptoms, we have cognitive symptoms, poor executive functioning, inability to understand information to make decisions, and poor working memory po, inability to use information immediately after learning. So, negative symptoms po, ito po, we have a lot of negative symptoms like flat effect, reduced expression of emotions via facial expressions or voice tone. Parang hindi po nag-match yung facial expression mo sa mga sinasabi mo or kung ano yung mga nasa thoughts mo. Alogia po is reduced speech, avolition, inability to begin and sustain activities, anhedonia, inability to experience pleasure, asociality, withdrawal from social contacts, reluctance to perform the everyday task. Ito po yung brain ng schizophrenic person. So, dopamine po yung affected po when you have schizophrenia. Ito po. Okay? Complications. So, meron din po tayong a lot of complications. Alright, aside from this, may mga pwede pong mag-match ng mga disorders, mental disorders with this schizophrenia. Depression po afflicts approximately half of schizophrenic patients. Okay, it is not always recognized or treated, but it can significantly add to the suffering of the person. Pwede po siyang maging comorbid. Okay? Also have anxiety. Many individuals with schizophrenia also have an anxiety disorder such as social anxiety disorder, PTSD, or generalized anxiety disorder, OCD, and panic disorder. Suicide naman po is one of the primary cause of death for individuals with schizophrenia. Okay, there are a lot of factors that contribute to the risk. Okay, this includes the psychotic symptoms such as voices telling the person to kill himself, substance abuse, recent diagnosis of schizophrenia and comorbid depression. Pwede rin pong substance abuse and smoking, okay, violence, and self-injury. Okay, let's go to the diagnosis under DSM-5 of what is schizophrenia. This includes the criteria, okay, for diagnostic and statistical manual of mental disorders. Okay, so a thorough medical history is the first step in the diagnosis of schizophrenia. Okay, so psychiatric evaluation po, a doctor or mental health professional checks the mental status by observing the physical appearance, demeanor, and asking about thoughts, moods, and awareness to the person. Okay, so ito po yung mga symptoms po na usually have over the months. Delusions, hallucination, disorganized behavior, so on and so forth. Prognosis po. So, there is no known cure for schizophrenia. Fortunately, there are effective treatments that can reduce the symptoms, alright, or decrease the likelihood that the episodes of psychosis will occur again. Okay, how to manage? We have a lot of therapy po. We have individual therapy, social skills training, family therapy, and so on and so forth. You have also ECT or electroconvulsive therapy and cognitive behavioral therapy. So CBT aims to help to identify the thinking patterns that are causing to have unwanted feelings and behaviors and learn to replace this thinking with more realistic and useful thoughts. Alright. Okay, so may mga treatments po tayo for schizophrenia. Antipsychotic treatments. Okay, it has some adverse effects as well. So the medication can have effects like sedation, autonomic side effects, extrapyramidal side effects, okay? And yun, so on and so forth. Ang dami pong mga gamot for schizophrenia. Ayan po, that's all for today. I hope you've learned something about this mental disorder. Thank you so much for listening. And that's all for today, my egos. Thank you so much for watching. I hope you share this to others. And don't forget to subscribe.